Usually, when I describe a point and its usage, it is not just by function, but also by confirmation. So I might think of a point of, yes, this point is a good point for thyroid, and you confirm it by the fact that it releases, say, stomach 9 area, or a certain area in the abdomen, etc. So this is very style dependent. Some people might describe the points as creating certain changes in the pulse, etc., all depending on the style of acupuncture you use. In this presentation, I'm trying to strip some of that away and give points in the way that the most obvious usage for them, independent of the confirmation or independent of other conditions for them. So, for example, things like if there's endometriosis, liver 5 is an essential point. If there is fibroids or cysts, liver 8 is an essential point. If there is a thyroid condition, kidney points are essential. So I'm trying to give sort of more quick pointers on the use of the point and give you, with your own style, the way how to refine it and confirm it. So the first point that I'd like to discuss is kidney 7. So here the buzzwords would be ovaries. Anything to do with ovary is very likely to be within the kidney 7 domain, and anything to do with thyroid is very likely to be within the kidney 7 domain. The official line on thyroid is that hypothyroid is supposed to be better with kidney 3, but I do not find that that's true. And kidney 7 is supposed to be better with hyperthyroid, but quite honestly, I find that kidney 7 works for either thyroid condition just as well. And kidney 3 sometimes might work better, but not always. At kidney 7, you will often find, if you just move your finger slightly up from the heel upwards, you will find that there is a place where you almost feel like the muscle, the gastrocnemius, is almost falling down. And that's the kidney 7 that I'm usually interested in. The name of the point is to recover the flow. Here you're recovering the flow of the kidney channel upwards. The kidney channel is supposed to have what we call Qi, meaning pushing down to lift up. The kidney, the bladder, and the spleen channels are all supposed to have Qi. So what happens very often is that there's only a downward falling and there's no upward generation in the kidney channel for many people. So kidney 7 is the point where you can recover that flow for the kidney channel of, yes, pushing down, not just falling down, and lifting up. And when that's missing, everything in a torso is sort of sluggish and falling. All the organs are going to be operating slowly. So besides ovary issues and thyroid issues, and ovary issues will often reflect on stomach 28 because that is where the ovary is. So kidney 7 should alleviate pressure pain on stomach 28 if there is such. And thyroid issues will reflect on stomach 9. So kidney 7 should alleviate the pressure pain in the neck and stomach 9. This point I also use for pain on the quadratus lumborum, tightness at the quadratus lumborum. So that's low back pain as per kidney, but not so much in terms of bones, in terms of the spine, but in terms of the actual muscle. So a little bit different. For the spine, usually I will use kidney 7 with spleen 9, not just kidney 7. Kidney 7 is also very good for when there's pressure pain on gallbladder 26 or the pectoralis, congestion in the pectoralis, which leads to the shoulders rolling in. So it's a very good point for shoulder pain on the large intestine and the lung channel. It tends to be a point, supposed to be a better point when the pulse is slow or regular, and kidney 3 is supposed to be somewhat better when the pulse is rapid. I don't find that this is always the case. So it is also kidney 7 a point for bones, which can be combined with moxa on bladder 11, the meeting point for bones. So any sort of bone issue, whether it's arthritis or broken bone, etc., kidney 7 is a good point to consider. But the two main big themes are thyroid and ovaries. Kidney 9 is another kidney point that I use a lot. The name is Jubin, which we can translate as a guest house. So it's a point that either pushes unwanted guests away from my own house or allows me to occupy fully my house. It is a point that clears the liver, although there are other points that do liver clearing. But when you're not sure how to work with the liver, kidney 9 will often clear the liver. And it is, the keyword here is detox. So if there is an issue with a patient that in their history they used to work at, let's say, a paint factory and smelled lots of fumes, or they took some crazy medications for a very long time and their problems started after that, you are thinking of wanting to clear out that toxicity. So that is clearing out the guests, the toxins from my house. That is kidney 9. It's also a good point emotionally for addictions. It is also a point for when there's a pelvic shift or neck problems or for TMJ. It's a very good point. It is also a good point for thyroid issues, especially when there is a goiter. To some extent, kidney 7 and kidney 9 share a lot of properties, and sometimes you can actually use kidney 7 more for detox, might happen to work better, and things of that nature. So these are the official lines. Sometimes one would do better than the other. Both points are points that affect the physical kidney, the actual kidney as well, the organ. The next point is actually on the kidney channel. It is not a kidney point though. That's called inner yin. It is on the kidney channel about 5 fingers above kidney 10. This is a very, very important point. The main usage of this point is really to support the perineal floor, to give the upright posture its rooting. Many people everything just falls down in the legs. So inner yin is a place where things start to lift up. It's as if there is a straw between the thighs, and the person should be sucking up the straw into the perineal floor and up the front of the spine. So it supports the whole structure. And it's a very good friend of side gallbladder 27, 28. The official line for this point, the things that it's supposed to do is it's supposed to release the trapezius, which it does. It also releases the scalenes. It's also a good point for constipation. And one of the big functions of this point is it is a hormonal point. So women with hormonal issues will also often feel quite painful around inner yin and using inner yin. So this is both an assessment point and a treatment point that can be used for hormonal issues. Liver 9, which is at the same level. Okay, so liver 9 and inner yin are at the same level. Liver 9 is on the liver channel. Inner yin is on the kidney channel. So this also is a hormonal reflex and treatment point. And it is also a very good point for eye. And again, I will sometimes interchange the 2 points because the distance between them is not that great. You know, they are on different channels officially, but they're often quite interchangeable. Kidney 4 is an interesting point. You can call it either kidney 3 or kidney 4. It's kidney 4 if I needle it down towards the heel, and I would call it kidney 3 if I'm needling it towards the Achilles. So it will be kidney 3 if I'm using it for thyroid issues, and as I said, I tend not to do that a lot. But I do use it as kidney 4 for lung issues. So kidney 4 is called Zong, the big bell. And the bell is basically, you can see the character for metal, and it's being hit by a servant. We'll see this character in gallbladder 39 as well. So it's something that's like a clock or a bell, something that's constantly chiming and is made of metal. So that would be the lungs. So this is the point on the kidney channel that affects the lungs, specifically inhalation, because we're always interested in the kidney grasping the chi part of the inhalation. That is often a big component that we're looking for in asthma. So when that happens, kidney 4 is the point that would be my go-to point. And moving on to the liver channel, even though we touched it with liver 9 for a second. So liver 8, the bent spring. This is my main point for cysts and for fibroids. Anytime someone has a history of cysts or fibroids, so they may not come for that. They may have even had their uterus removed because of fibroids or something like that. Whatever the problem is that they're coming for, but there is a history of fibroids or cysts, I will check if liver 8 is a good point for them, because by their constitution, liver 8 is a point for any sort of accumulations, including fatty liver, for example. It's also the point for tendons and ligaments. This is more of a point of quote-unquote nourishing the blood for tendons and ligaments. Gallbladder 34 is a point that I consider to be a point for torque, and ligaments get torqued. But I don't consider gallbladder 34 to be nourishing the tendons. So there's somewhat of a difference here. Here is liver 5. And just to show you, I take liver 5 literally on the bone, and I take the spleen just behind the bone. I am aware that many people take the spleen channel, the liver channel right behind the bone. In my opinion, that is not accurate, and for the use of liver 5, that's definitely not going to be the case. You want it on the bone, you want to find a hole in the bone. There's usually more than one, there's usually at least 2, and I usually go for the one slightly higher. So liver 5 is defined as, by the text, as 5 cun above the ankle bone. I would go a little bit higher, look for a hole in the bone. Now, both liver 5 and spleen 7, when they're active, will have sort of like a pitting edema feeling to it. So when you press your finger into the point and take the finger out, there will still be a little bit of a hole there. That's true for both points. Spleen 7 I use for edema, for pitting edema or any kind of edema. Liver 5, however, is my point for endometriosis. Okay, so anybody with a history of endometriosis, this is a great point for it, and that really should be direct moxa, and a fair amount of direct moxa, 15 to 21 OQ moxas. So even if a woman comes and she's had endometriosis and it's no longer the issue, and the issue is, let's say, back pain, it's amazing how moxa on liver 5 solves the back pain or the neck pain or the gum pain or whatever. Liver 5 is also considered a very good anti-inflammatory point for the lower jiao, often with spleen 5. So things like PID, etc., etc. It's a very good point for skin, itchy or oozy skin, and it is also the point of choice for gout. Liver 4, so in terms of location, liver 4 is not at the ankle bone according to Lingshu 2, and also not according to my clinical experience. The point that's on the liver channel at the ankle joint is not very useful. Go about a cun below it, and you will find like a mushy feeling there, something that feels soft, like a dent that feels soft and mushy. And you want to needle it with a channel, because Lingshu 2 very specifically says that if you go against the channel, you create disharmony, and by going with the flow of the channel, you create harmony. And I think where it's the harmony is at the center in the abdomen. And the reason why is, we'll see in this slide, is by the name. It's the seal of the center. Okay, so where it creates harmony is in the center, but specifically at stomach 30. The character, the Zong Feng, the Feng, the seal, the authority, has this tablet, and this tablet, this authority, is the same as in the name in stomach 30 in Qi Jie. You can see the same character between walking in the Jiao of Qi of stomach 30. So liver 4 is my main point for releasing the psoas or the inguinal, and also used for lower back because of that, when the psoas pulls the lower back. Sometimes liver 8 is not doing as good a job for ligaments or tendons as you might want, and then liver 4 might actually do the job better. It is a very famous point for those who study or use the Kiiko style for what we call oketsu, stagnant blood, which reflects on left stomach 27 area. However, in, say, the last 2 decades, there are not a lot of patients who come with oketsu. That was very common in the 90s and a lot less common nowadays. But that's how most people got to sort of get acquainted with this point, which in TCM almost practically doesn't exist. So liver 4 would be pretty much my version of TCM's liver 3. It is also a good point for releasing the liver. So again, just like kidney 9 is a good point for releasing the liver when there is not 100% clarity as to what's going on with the liver, and you didn't manage to release the liver with your other strategies for, say, liver deficiency or liver excess. When the clinical presentation is not quite so clear, sometimes liver 4 is the point to the rescue sort of thing and releases the liver. Spleen 3 is the main point for diabetes. It should be used with kidney points, as well as the immune points, as well as OD, right side stomach 22, as well as thoracic, the Watteau of thoracic 11, 12. But it is the main point for sugar imbalances. Sometimes spleen 9 might do as good a job. But my first go-to point will be spleen 3, any sugar imbalances. It's also the point for muscular pain, any kind of muscular pain. It's also the point that releases the brachial plexus congestion, meaning the scalenes. It is the point whenever there is numbness or neuropathy, which of course are very common in diabetes. It is a big point to be considered for anxiety and depression. Which will often show on REN 15 or REN 17. And in that case, I do add the pericardium. The spleen is almost always involved in any sort of mental, emotional issues, because the consciousness, the awareness must always be there. It doesn't matter if the issue is anger or the issue is sadness or the issue is anxiety. I mean, you can match the actual issue to another so-called phase within the 5 phases. But in order for me to suffer from something, I need to be aware of it. My E has to be there to know. That's why the spleen is almost always going to be used in any sort of emotional issues, in anxiety, depression, etc. And spleen 9 is another big point on the spleen channel. This point I needle actually parallel to the skin and up towards the inner knee eye. It is a point that is best when you find chubbiness in that area. So like there's the weight is falling down on spleen 9 and then there's like extra tissue there. If it's all very tight, like younger men, well, often the point will be very tight. It will be very hard to get a needle in. Okay, and especially if you're trying to needle upwards. If you're trying to needle towards gallbladder 34, that's a different story. And that's not what I do. I'm actually needling it with the flow of the channel. So spleen 9, its big go-to things are appendix. Anybody who's had their appendix removed, spleen 9, at least on the right side, is of paramount importance. It's going to solve a lot of other problems for the patient besides the, releasing the area of the appendix scar, usually right stomach 26, 27. It's also the best point for L4, L5 problems. However, L4, L5 problems can often involve a torque at the sacro-iliac ligaments, in which case you want to use gallbladder 34 as well. Notice that gallbladder 34 and spleen 9 share a name. They're both Ling Chuan. They're both mounds and springs. Okay, one is the yin and one is the yang. Spleen 9 is also a very good point for pressure pain on gallbladder 21. So if the patient comes and says, I have pain on gallbladder 21, not the whole area, not the whole trapezius, but on gallbladder 21, spleen 9 is definitely likely to be a very good point. It's a very good point for diarrhea. I use that with spleen 5 and spleen 9 on the left side, with liver 4 and liver 8 on the right side. It is one of the main points for blood pressure, with spleen 6 and with pericardium points, and with a point under the third toe, which we will see later. And it is used for Parkinson's with gallbladder 39, for brain damage when the pulse is wiry, meaning it is an excess pulse, a strong excess wiry pulse. There are other pulses that some TCM people will call wiry because it has a tight quality to it. But if it doesn't have strength, if it's not excess, that I do not call it wiry. I would call that pulse a tight pulse. So spleen 9 is for, with gallbladder 39, is for true wiry pulse, meaning an excess pulse that feels very tight. And these people often have some sort of brain injury. Spleen 7 we talked about before. It's the leaking valley. So it's used for water accumulations. And for edema. So your main point for edema is find that place where you when you push your finger in, it has a peeling edema behind the bone, and moxa is very good on this point. It's also a good point for ear infections and inflammations, used with Jiao 8. It is a good point for stopping bleeding, and it's also a support point for prostatitis in men. Stomach 41 is a really important point. There are all these points on the stomach channel, say from stomach 40 down to stomach 41. There are all these bumps, and yet there are no points in them. And those are called the stomach chi points. And those are used basically when the pulse doesn't have a forward movement, when you don't feel a wave of the pulse moving towards the thumb. So stomach 41 is, let's say, the mother of these points. But I use it primarily, now of course it is the fire point on the earth channel, so really it should be, stomach 36 is earth on earth, but fire on earth is the tonification point. So in some ways stomach 41 should be the is officially the tonification point of the stomach channel. That somehow stomach 36 has been the big go-to point, but stomach 41 or the stomach chi points with moxa are actually often much better than stomach 36 in my experience. But the main thing that I use stomach 41 for is structural. So it is the best point for knees. No matter where in the knee, it's going to do a great job for the knee in all likelihood, usually combined with spleen 5. And of course, they're very close. Same side as the knee problem. It can be used for heel problems, for thigh problems, for back problems, for hip problems. Very often when a patient comes for structural issues and I do everything I've done, but I didn't do stomach 41, when they get off the table and they say, there's still something left in my whatever, hip, let's say. And then I press on stomach, they're standing and I press on stomach 41, they say, oh wow, now it's gone. I will leave a press tack there, and of course the next time I will remember to needle stomach 41 as the first thing that I do. But stomach 41 is an incredibly important point for all structural issues, because it's the axis on which our weight moves on the heel. So we have a number of places where the weight is being shifted. One of them is the transverse arch of the foot, that is spleen 3 to bladder 65 area. But that's after the weight has been manipulated through the heel. So actually, in some ways, that arch of the foot, which is where the shoe points are, okay, the shoe points are supposed to communicate between the channel and the organ. That line of the transverse arch of the foot is a little bit less direct as the heel itself. So the heel, which means stomach 41, kidney 6, UB62. So those are the yin chow, yang chow. And so you can see that stomach 41 is almost like a yin chow, yang chow middle kind of thing. That's an axis on which we are constantly shifting our weight, and therefore all our gait, and therefore all our, everything that not just depends on weight, but is influenced by weight, like our biochemistry, will be shifted according to how stomach 41 is. So this point is really useful to look at any structural issues and also for internal issues as well. The third area would be the knees. And the knees in Chinese are, the points around the knees often have the character chuan, a fountain, to generate upwards. A fountain moves upwards, a spring moves upwards. It has that kind of energy. Often what you see, especially with if they're slightly overweight and more overweight patients, you will see a lot of chubbiness under the knee. All the weight is falling, which means everything is sluggish, and there needs to be a generation of upwardness from the knee up. So that quality comes from the knee. And of course, the next area would be the hip, but the hip is a lot harder to manipulate. It's a lot easier to, when you put a needle at the ankle, you do some movement at the ankle, it's going to create repercussions much more easily than a big joint like the hip, where it's going to be a lot harder to manipulate that joint and creates more vibrations from it. So the transverse arch of the foot, the ankle, and the knee are really important to create vibrations throughout the rest of the body. And of course, that's where we see major points. So it makes sense. Another point on the stomach channel that I don't use so much in needling as much, although I do use a fair amount of it, but primarily I use it as a reflex, and that is stomach 9. It's called the Zhenying, the welcome human. So this point reflects, by pressure pain, thyroid. If people have a thyroid problem, mostly it's women, because women are more susceptible for thyroid problems. There will be pressure point around stomach 9, a little below, a little above, on the SCM, a little behind, etc. And then I use kidney points. It also, this area, same area, reflects the autonomic nervous system, in which case I treat the opposite side, Sanjiao 8, which we will see later. It's also point stomach 9 that it's what we call a primitive reflex, meaning when somebody, things like bulimia or nauseousness or things like that, it's not something you control. It's a very primitive function of the body, often related to digestion, obviously. And that's when I use I use the stomach chi points, meaning those bumps along the stomach channel from stomach 40 down to stomach 41. Needling stomach 9 specifically I do for treating the cervicals, and especially for C4, and C4 is related to the phrenic nerve. Therefore, needling stomach 9 can release the diaphragm and the autonomic nervous system, which of course it reflects the autonomic nervous system. I needle the point going slightly in and then kind of behind and down the SCM. So it's really, I'm not looking anywhere near the carotid artery. It's, I use a 0.12 needle, that's sarin dark greens. So a very thin needle. I'm not trying to break down major connective tissue here or anything, muscle congestion or anything, just very slight, and just manipulating the needle in and out very slightly is, all one needs. Gallbladder 39, so we saw the name, the Zong part of the name, the bell part of the name. This point is called the Xuanzhang, the suspended bell. So, of course, it is the meeting point for marrow. So it is indeed a very good point for spinal issue and scoliosis. It's also a very good point for brain injury, as we talked about with spleen 9, when there is a wiry pulse. So this all relates to the marrow part. But it's also a very good point for people who have skipping beats, heartbeats that are skipping. Again, because of this character bell. The bell is suspended. In this case, the bell is not a metallic bell. I hope not, at least in the case of the heart, not related to the metal phase. But still, it is a bell nonetheless. The heart is a clock that keeps chiming, keeps contracting regularly. When a person has a missing beat or, the pulse is suspended, so to speak, that's gallbladder 39 is a very good point for that. Supporting points for that are actually gallbladder 5 and 6, which also have this character suspended, xuan, in them. But gallbladder 39 would be a big point that I would look for somebody who has a skipping beat, again, regardless of the symptom that they came for. Okay. Gallbladder 34 is famous as the ligament point, meeting point of ligaments or tendons, supposedly, but I really think it's the meeting point of torque. Think of when you go skiing and you're torquing your knees from side to side to keep yourself upright and straight, moving. Gallbladder 34, between the fibula and the tibia, keeps shifting around. That's why it controls torque. And tendons, certain tendons at least, have a great tendency to be torqued, and then they're pulling, and then they create problems. So typical of that are the sacro-iliac ligaments. Those are the ones that you see. And gallbladder 34 very, very clearly releases the sacro-iliac ligaments. And if the sacro-iliac ligaments are released, then the rest of the spine is released. So any spine problem, first check the sacro-iliac ligaments, and we will see those in a moment. Gallbladder 34 is also a good point for wrists and shoulder. And I believe TCM says the same thing. It's also a good point for calf cramps. That was misspelled here, apparently. It is a supporting point for hot flashes with spleen 9. And if you are inclined to do exorcism treatments, it can be the last point that's needled, and it determines kind of what you want to do with a so-called entity at the end of the treatment. In other words, if you want to burn the entity, you would do moxa on gallbladder 34, for example. If you want to bury the entity, you'll take the needle and bury. That was in gallbladder 34 and bury it. But because it's a mound, so it's a burial ground, so it's a way of metaphorically dealing with things that we're trying to exorcise out of the body. And by the way, we talked about kidney 9. Kidney 9 being the guest house might be part of a treatment of that nature. Bladder 36 is a great point, I think way underutilized point, partially because of the location and partially because, well, you have to have the patient lying face down. I always treat people face up first and then face down. I always do 2 treatment on both sides, so it's not as big a problem for me, but many people only do one-sided treatments. So bladder 36 is not as enticing because mostly we do front treatments. The name is support the support, to support the structure. It's the main supporting point, which you can totally tell from the name and the location. It's a great point for back pain. Kauai does use a point that's about 2 fingers below for back pain, but I actually use bladder 36, and I would use more than 1 point. I would go more medial, more lateral. I would use 3 or 4 of them conceivably. It's a great point for any structural issues, because just like stomach 41, this is one of the axes that we have. It's an axis even when we stand up. Certainly it's an axis when we sit down. So the ischial tuberosity is extremely important, and how we angle the ischial tuberosity is going to affect the rest of our body. That's true when we stand up, and it's certainly true when we sit down. And what will often happen is you will see a patient come in and they sit at the chair, and they're sitting, and they're not sitting on their thighs. They're really sitting on their buttocks and almost on their spine, on their tailbone. They're leaning back and slumping down. And when you tell them, put your heels down and see if you can sit on the fronts, on the thighs, on the top of your thighs rather than on your buttocks, they say, oh yeah, my shoulder pain's getting better. So bladder 36 is an extremely important point to re-educate the posture and give it better support. It just has such an incredible name, but it has an incredible location. So the 2 match. Now, when we look at the bladder line, we're going to see a number of things. So we see the Huang points. So Huang often is translated by TCM as some mysterious area between the heart and the diaphragm or something along those lines. But if you're looking at the character Huang, at the top you have Wang, which is something that's dead, that's perished, that's missing, that's buried. Okay? The etymology of the character above it is to enter into a concealed space. And the lower part of the character is basically in the body. Any organ has that lower character. So this means something that's dead, that's perished, that's missing, that's still in the body. Okay? And interestingly enough, we have a number of Shu points associated with Huang. So we have Huang Shu, kidney 16, and we have Gao Huang Shu, bladder 43. So what is missing in our body, okay, what is dead, but still has a shoe, a transportation capacity in the body. So that conceivably will be our ancestors or our DNA, our genetic code. Our ancestors are no longer alive for the most part. Maybe my grandmother might still be alive, but most of my ancestors, the vast majority of the generations have perished. Okay, but they're still influencing me. They're still creating movement, transportation in my body. They're influencing me. So the idea is that the 1 points have to do with inherited health problems or things that came in utero. Okay, and especially bladder 43, but also kidney 16 and also bladder 53. I can't say that I find that totally true for bladder 51 outside the Sanjiao. So Huang points have to do with hereditary, with genetic disorders or disorders that came to us when we were born. Okay, not acquired after birth. And then when we look at the outer bladder line, again, so at the top, the inner border of the scapula, we see this is oxygen supply and circulation. Which makes sense because it's right behind the heart and the lungs. These are extremely important points. I needle them out towards the scapula and I tend to add moxa on it for any sort of lung problems, heart problems, although I will release those points first, especially with cardiac issues. You do not want to stimulate the heart directly by doing moxa on the inner border of the scapula. And stimulate the heart without using other points to move the circulation also. This is an area that a lot of people, because of the kyphotic issues that we all have, it is a congested area on anyone, or most people rather, and I will resolve it first by using small intestine 9-10, which I believe we'll see in a moment. Bladder 49, needled upwards outside the spleen shoe, is a very good point for depression. And for lifting the back of the ribs off the waist. What happens is, again, all this falling down kind of posture that we have, the ribs are just falling into the waist, congesting the waist into the legs, because we're not pressing down in our legs to support our waist, to support our ribs. So sometimes you'll see that around T11, T12, there's a big falling down and almost backwards. So needling bladder 49 upwards is a very good point to support that and for depression, because that posture kind of creates a depression. Bladder 52, although it can be bladder 51, which we just saw before, Huang Men, is a very good point for a weak dantian, which you can often tell because there's a pulsing in the abdomen. It is a good point for adrenal support. But also, when you are doing the points above the outer bladder line on the inner border of the scapula to open up the chest and open up the circulation of the lungs and the heart, you need to make sure that at the root of it, at the waist, there is enough support. So bladder 52 needled inwards towards the spine is important to stabilize, so you're not like moving the energy of the chest, the pectoral chi, without basic support at the bottom, which you can see the idea in the Zong chi, in the pectoral chi is described as being rooted at stomach 30. Okay, so on the back, this is a little bit of an equivalent. And bladder 53, which is Bawang, is a great point for all gynecological issues, for the uterus, as well as for the spine and the back, because it is basically on the sacro-iliac ligaments, which I believe we're seeing now. Not quite yet. So to release the area between the scapula, I use what I call small intestine 9-10. This is a point that's between small intestine 9 and 10, but take it slightly back towards the torso, into the torso. Not quite at sun, into the torso. What you'll find a place, a point that when you press on it feels springy. There's a spring there. So it's between small intestine 9 and 10 and ever so slightly back towards the torso. This point releases the rhomboids and the upper thoracics and the inner border of the scapula, and it affects the sympathetic nervous system. It calms and soothes the nervous system. It's also a good point for shoulder, especially deltoid issues. it is actually needled. I needle small intestine 9-10 towards the deltoid, up and out towards the deltoid. And it's a very good point for people with blood pressure, which is issues, whether it's low blood pressure or high blood pressure, which is really part of an autonomic nervous system presentation. Small intestine 11 is a very good and important point. And here we see this character Zong, Tian Zong, the heavenly ancestor. It's as if our heavenly ancestors are looking down at us and we're moving forward. So they're looking at our back because they came before us. And they're penetrating us, penetrating our heart at small intestine 11, if you like. So this point has to do with the circulation of the Zong Qi, especially on the left with cardiac issues. So people with cardiac issues will often show pressure pain on left small intestine 11. They may also show gumminess or pressure pain on the inner border of the scapula on the left side. These are areas that should eventually be needled and/or moxed. And on the right side, small intestine 11 reflects digestion, meaning gallbladder, liver, stomach, or small intestine issues. And small intestine 11 is also the breast shoe. So, for example, if somebody has cysts in the breast, I will use liver 8 on, when I'm treating them face up. And then I won't treat small intestine 11 necessarily when they're face down. I'll have them sit up and I'll have them touch the breast and feel the cyst. And then I'll find the best place in small intestine 11 when they can tell that under the finger, the cyst is actually shrinking. They can tell, they can feel the cyst shrinking, sometimes to nothing. That's the point that I will needle and do direct moxa on. So small intestine 11 is like the breast shoe. And here is a picture of small intestine 11 being surrounded because it was puffy. So it's being surrounded by needles, like I think they call it something with a dragon, chase the dragon or catch the dragon or something like that. And you can see the ashes of the moxa as well on it. Now let's look at the dew points. Dew 16 is a very good point for spine and for the brain. Dew 14 is very good for all cervical issues, and this Dew 14 can go down to vertebrae as well. So you can say C7 to T2 easily, and actually almost to T5. At T5 to T7, what you have is you have the height of the kyphotic curve. Okay, and at T11, T12, you have that change, the transformation from thoracic to lumbar, or from lordotic curve to kyphotic curve. At L2, you have the height of the lordotic curve. So what happens is and at L5, you have a transition from sacrum to lumbar. So in a bow, where you have the biggest changes in curve, that's where there's going to be the most potential energy stored. That is why the points at T5, T7, T11, T12 are generally the most powerful points, because these are the height of the lordotic and the kyphotic curve. Okay, so actually T11, T12 is a change from lordotic to kyphotic, but these are the change points. So they're going to store the most potential energy in them, and affecting them will open up, one, the nervous system, because we're talking about the spine, and the structure in general, and they will affect the organs the most. So that's in general why these points are going to be used the most. Dew 2 opens the whole spine up. Okay, and so any sort of spinal problems, I will needle Dew 2 upwards. And it's also a very good point for autonomic nervous system disorders, which I will check against left bladder 43, which basically reflects the pacemaker, which is a component of the autonomic nervous system. And now we're looking at the sacrum, at the sacro-iliac ligaments. So the actual sacro-iliac joint is this green area here between the sacrum and the iliac bone. However, in most people, it's extremely difficult to get in here, especially on men. It's too tight. So what I do is I go for the red area, which is this is getting the ligaments from the iliac side. Because if I release the ligament, I'm releasing that joint, allowing the whole spine to free up. So the purpose of these points is primarily to release the spine. They are also being that they are bladder 53 area. They're also for gynecological problems as well. Now there's an extension for these points which is under the iliac crest. Some people have a lot of gummy tightness under there, and then you want to needle it. If you're needling the red area, needle it in and up slightly upwards towards the opposite side, as if you're trying to needle towards opposite gallbladder 26. The needle will eventually look as if you needled it perpendicularly because the ligaments are just very tight there. If you're needling the blue area under the iliac crest, needle it in and up towards the scapula. And that needle will often stay that way. So you're doing it to some extent in that in that direction. Don't just needle 90 degrees in. It's not as effective. So sacro-iliac points are extremely important to release the whole spine. And then when you've released the spine, then you can use T11, T12, say for sugar issues, T5 for stomach issues or autonomic nervous system issues, etc., etc. So I start with do 2 to release the spine, sacro-iliac ligaments, and then I do more according to what I find. REN4 has a very interesting function, actually 2 of them. One is by the name Guan Yuan. Yuan means primary. So it shows the head on top of the feet. So it's a point that clearly relates to the head. So it is a point that you can use for headaches and head issues. But primarily it is the main usage of this point is for autoimmune disorders and for cardiac disorders. It is a point that should be used with rapid pulse and not with slow pulse. It's not a good point for slow pulse. The reason for that is because if you stimulate the lower abdomen and with a slow pulse person, the pulse gets slower. We know that because when you're all uptight and the pulse gets rapid, we breathe deeply into the lower abdomen, and then everything slows down. So if somebody has a really slow pulse, it's not in our interest to slow them further. That's not really what we're trying to do. So this is a point for normal or rapid pulse, not for slow pulse. It is the main point for autoimmune disorders with kidney points and lung points. Okay, so I use REN4 plus, say, kidney 7 and lung 5 for any autoimmune disorder. And it might be kidney 9, it might be lung 8, it might be different lung or kidney points, but always REN4. If the pulse is slow, meaning I cannot use REN4, I will use side gallbladder 27, 28. It's also the major point for cardiac issues, especially if the pulse is floating or not held. And again, for rapid pulse, or not slow pulse at least. So those are the main usages of REN4. And here is side gallbladder 27, 28. So basically you're looking at level of REN4, but taken totally to the side, below gallbladder 26, as if the gallbladder line went straight down. So in most texts today, the gallbladder line goes down and then zigzags into the inguinal and then out towards gallbladder 29 to gallbladder 30 and then back to the side of the leg. If you took that zigzag away from it, gallbladder 27, 28 will be totally on the side, basically level with REN4. And these points provide this is a good area, a good point that supports inner yin when we talked about supporting the fascia of the body, supporting the lift in the torso, to providing space in the torso. Extremely, extremely important point to use. You can call this point mushu if you like, because it's between the mu point and the shu points. So together it becomes mushu. But I think only Americans understand this joke, because only in America do they call this mushu, the mushu food in Chinese restaurants, is my understanding. It establishes the space for the organs within the torso. It's a way of squeezing, of extending the torso, and therefore coordinating the 3 diaphragms or the 3 dantians. And it is a point that I will use instead of REN4 when the pulse is slow. By the way, REN4, you cannot use REN4 for certain autoimmune disorders that involve the intestines. That means Crohn's and ulcerative colitis. Because there is inflammation possibly underneath REN4, you don't want to needle it. So instead of REN4, regardless of the pulse, I will use side gallbladder 27, 28. Okay. Now these points are below the iliac crest. People sometimes ask me, where is side gallbladder 27, 28 compared to gallbladder 26? They are at least 3 tsun lower. Okay, they should be below the iliac crest in the tensor fasciae lata muscle, or the glute. In the glute medius, not the tensor fasciae lata. They're in the glute medius, so you feel like a ropey place there. You press it, and things start to change. Now you can see from the names of the points that they are supposed to be, they have something to do with supporting the 5 pivots. Okay, the 5 axes. Okay, almost related to stomach 41. And, and the number 5 is a number of completion. And Wei Dao for gallbladder 28, the linking of the path. So it seems to suggest, that the ancients also saw the same ideology of it supporting the network, the fascia of the body. Okay, giving it a base, giving it an axis. Okay. Next is a point I use lots and lots and lots. It's almost automatic, and that's Sanjiao 8. You can call it Sanjiao 9, and the reason why is because actually this Sanjiao 8 is a third below the elbow. So it's way above the textbook description of both Sanjiao 8 and Sanjiao 9. I prefer the name for Sanjiao 8. San Yang Lo, the 3 yang connections, because this is the point that affects the autonomic nervous system, meaning it has a way of affecting excess yang, excess excitement in the nervous system would be yang, and this meeting place can soothe it down. You can say that Sanjiao 9, which is called it's called the 4 ditches really, but you can make it sound like it's the 4 rivers, and the 4 rivers will describe China. China has 4 rivers, meaning it describes the whole landscape, meaning it's very smooth, very easeful. But I prefer the name Sanjiao 8 because the point really, like I said, it's a third below the elbow. If you slide your finger slightly, lightly, from the wrist up the Sanjiao channel, that you will stop at Sanjiao 8. It just stops there. Okay, there's a little hole there. And that's the point. And it is about a third down from the elbow. It's a great point for autonomic nervous system. So the buzzword here is autonomic nervous system and releasing the SCM. Officially, it's supposed to release the SCM on the opposite side. Okay, so if you want to release the left SCM, okay, because it's tight, because the nervous system is tight, you're supposed to go to the right Sanjiao 8. But in truth, either side works. Okay, so I usually do both sides regardless. It's a great point for releasing the cervicals, okay, in the back of the neck. And that is the same side. And releasing the cervicals, of course, releasing the nervous system also. Sanjiao 8 is a better point when the pulse is slow or normal. If the pulse is quite rapid, Sanjiao 5, the regular Sanjiao 5, might do a better job. This point also is a good point for ear infections. But the primary use of it is to release the SCM, to release the nervous system, to release the organs. So it's a point that's almost like a preparatory point for everything else that you do, because there's so much stress and holding patterns of the nervous system in most patients' bodies. And here is the immune point, which you can say is large intestine 10-11 area, usually closer to large intestine 11, but it is not on the large intestine channel. It is slightly more towards the Sanjiao channel. It's on the edge of the bone. This is originally called the tonsillitis point. It is for any immune issues. Okay, so the buzzword here is immunity. Any kind of immune issue, whether it's catch cold or tonsil problems, sinus allergies, anything of that nature. And not just immunity in the head, also immunity in general. It's a good supporting point for autoimmune disorders as well. This point between large intestine 10 and 11 on the edge of the bone, there's a very particular feel for that tissue of the way the muscle adheres to the bone. You will get to know exactly where it is. It usually releases the area of Sanjiao 16, the gland area. So that's a way to check it. Should be used for any kind of immunity issue, increasing immunity with moxa. It's a great point for Shaoyang style headaches. Okay, so headache on the temples, this is a great point for, and it's a very good point for shoulders. I tend to add it for any shoulder problem as a supporting point. And while we're on the arms, pericardium 4, this point is called the Shi, as in a cleft, Shi Men, the door for the cracks. Okay, and this point is the main point in the pericardium. But let me just show you the location of it. So she's staying on one arm, and therefore you can really see pericardium 4 very clearly. So I take it about 3 fingers or 2 tsun below pericardium 3. This is not the regular location of pericardium 4 by the textbook, which I believe is 5 tsun above the wrist. This is or 4 tsun above the wrist, I'm not even sure. But this point is where there is a crack in the channel. Okay, so this point I use for any autonomic nervous system disorders, anxiety, depression, insomnia, etc. Now, on the pericardium channel, because the pericardium channel is related to the nervous system, to these things, it protects the heart, right? So you can choose which points to use. If pericardium 8 is painful, I will needle pericardium 3 in the center of the elbow between the 2 tendons, and pericardium 5. These are the metal and the water points. If fire point is painful, I use the metal water, because water overcomes fire, that's pericardium 3, and metal, pericardium 5, is the mother of water, meaning it helps water to overcome the fire. This is a principle that allows you to tonify in order to release fire. Rather than reducing to release the fire, you can tonify the water and tonify the metal. However, if pericardium 8 is not painful, you can use pericardium 4 or pericardium 6. And I tend to use pericardium 4 more often than pericardium 6, partially because it's more convenient to needle. You can check which one does a better job by which one releases more of the neck. Okay? So this is a point that's considered to bring blood into the abdomen. So if the abdomen is cold, pericardium 4 can be a good point. And it's used for any blood disorders, for example, with anemias and things like that, often with spleen 6. But its main characteristic is for any autonomic nervous system disorders, insomnia, depression, anxiety, things like that, and blood pressure issues, in which case it will be combined with spleen 6 and spleen 9. So we saw this already, just to show you the point, and then seeing it in normal location. This is just an arm. Actually, it's my arm. So you actually see that there's 2 cracks, and both of them are way above the official pericardium 4. So when I say pericardium 4, I mean that top arrow, which is a few fingers below. If you slide your fingers just very lightly below pericardium 3, you will feel a dip there. You won't see it on most people, but you will feel it on just about anyone. So I thought I had the point under the 3rd toe in here also, so I will add that on description, because it is a great point for blood pressure. So that's under the 3rd toe, where the toe meets the ball of the foot in the center of that crease, and it's on the underside. That's a great point for blood pressure and for the autonomic nervous system. It often releases the occiput and the neck in general, but especially the occiput on the opposite side. But that is the main point for blood pressure. So these are points that I use a lot. These are, say, my 20 go-to points. And very much according to condition, and then I confirm these points in accordance to how they change the abdomen, how they change the pulse, etc., etc. But the attempt here was to try and make it very independent of style, and almost like a dogmatic approach that says, oh, you have cysts, use liver aid. Oh, you have blood pressure problem, use under the 3rd toe. And that they, to a large extent, will work. Of course, they won't work on everyone, but you will have a high degree of success regardless of what your style of needling and what your style of diagnosis and confirmation is. So I hope you enjoyed this, and I hope it's going to be useful for you and not too dependent on the way I think, that it's given you enough flexibility and ability to take these points and use them in your own way. Enjoy using them. Thank you.